Good evening. Welcome to another update and public conference on COVID-19 in Barbados and our efforts to beat back COVID. This evening, we have three guests. They are the Honorable Dale Marshall, Attorney General of Barbados, Dr. Kenneth Connell, who is Deputy Dean of Internationalization, Recruitment of the Faculty of Medical Sciences of the University of the West Indies, and Dr. Dion Greenidge, who is Head of the Department of Management Studies with the University of the West Indies as well. He also leads the Center of Professional Development and Lifelong Learning. We continue to focus on national efforts to beat back COVID. And this evening, we are going to be taking a deeper dive into the efforts that are underway to ensure that happens. As you are aware, we are now on national pause. The Attorney General will speak to us about what have been the challenges over the course of the last 2 days. He will reinforce messages for members of the public who still seem to have elements of uncertainty in relation to what they ought or ought not to do. And Dr. Connell is going to speak to the Seek and Save community-based initiative that is currently underway. What is its importance? Why is it necessary? And why should you cooperate? And Dr. Greenidge has been at the center of the design of that intervention, of that community-based intervention. And he is particularly responsible for the 431 people who are involved in the exercise and the interviewers in particular. He will speak to us about what happened today, the first full day of interviewing in the island. We've heard about threats for people setting pit bulls on Barbadians. We've heard that there would not be high cooperation. But what has really happened? What are the facts? And what more needs to be done? Are Barbadians cooperating or aren't they? Those are the issues that we will discuss today with you and with members of the media. We're going to start with Dr. Connell, who is also Queen Elizabeth Hospital's representative for the CDC. He has a CDC meeting this evening and therefore has to leave early. So I'm going to depart from the normal pattern. I'm going to ask him to speak first, and I'm going to ask the media if they have any questions for Dr. Connell, if they would pose them when he has finished speaking so that he can leave and go to his other important meeting. Thank you for coming, Dr. Connell. After you, we will hear from the Attorney General, and we will close with Dr. Greenidge giving us full information on what transpired in the Seek and Save interviewing effort today. Dr. Connell, welcome to our program, and we look forward to hearing from you. Why is the Seek and Save initiative important? What are the links relative to those persons who are suffering from chronic non-communicable diseases such as hypertension, diabetes, and so on? And would you please tell us how this effort is important in relation to the interruption of the wave of COVID-19 that Barbados is currently experiencing? Over to you, Dr. Connell.
Thank you, Ambassador Thompson, and it's a pleasure being part of your program finally. And also thank you, Attorney General, for allowing me to precede you in the order of protocol. So I'm excited to be here, not just as an individual scientist and Barbadian, but also as a member of the University of the West Indies. We're very happy to partner with the Barbados government in this. I know you represented it as a national initiative. I'm going to insert emergency initiative, a national emergency initiative to respond to a contemporaneous threat, and that is a disease or pandemic that is in community spread. And so on that backdrop, I'm going to start off by stating two things. First of all, it's not going to be business as usual. Many of us have realized this now for months. We've been imposed various lockdown restrictions, which the AG will speak to, various impositions about wearing masks and remaining physically distant. Our whole world has changed the way we know it. And so more recently, this lockdown aims to not just halt or pause the likely spread of a virus in the community, but it also gives us an important opportunity for us to seek or identify those individuals that are at highest risk, and also those individuals that are exhibiting symptoms. Interestingly, in our Caribbean space, we are also going through the dengue season, and therefore the Seek and Save initiative also aims to address some of the risk factors for dengue. Every Barbadian, every Bajan out there knows that both COVID-19 and dengue fever both present with a fever, and therefore some of the symptoms may be overlapping and confusing. So why have a mission like this? Well, my colleague, Dr. Ford, who is the infectious disease and specialist and head of the Harrison Point facility, would have already clearly identified many of the deaths associated with our pandemic internationally, but in particular here in Barbados, have been associated with high-risk individuals. Those people with NCDs or non-communicable diseases, such as high blood pressure or high blood sugar or diabetes. Apart from this, some of them have actually been at home with symptoms. And we do know also that the earlier patients present to a healthcare facility for monitoring and for starting whatever medications are being used as part of the treatment, the better the outcome. All that Seek and Save really seeks to do really is to go out there and to identify those patients using a standardized checklist of symptoms, as well as to collect various demographic information to identify those people in an algorithm who are at highest or higher risk. Based on these factors, then, these individuals are invited through the Ministry of Health team, not the university team, but the Ministry of Health and Wellness's team, to undergo rapid antigen tests. And then, depending on the results of those tests, then further treatment or advice can be given. And so, as a civic responsibility of an Indigenous university, the UWI has sought to be part of this because our relatives, we, as well as our friends and our family, all live in Barbados, and we have a responsibility to contribute to anything that counteracts a national emergency. The students have been out there, and my colleague, Dr. Grinish, will speak to this throughout the day in the sun. I didn't see any rain outside, so I will not say in the rain as well. But they've been out there collecting information. They haven't been doing it as some type of scientific research project, because I started off by saying, this is not business as usual. We have to respond to one enemy only, and that's a virus. They've been collecting information which will determine those people who are at risk. Because it's not business as usual, it doesn't mean that your right as an individual changes. In other words, you have the right to refuse to participate. You have the right to only answer those questions you feel comfortable in answering. Of course, we want you to answer all of the questions and to be as honest as possible, but we also recognize that you can say, well, I don't wish to be part of this. Many people have expressed fears. For instance, these are people coming out in the middle of community spread. Are they bringing disease to my door? The answer to that is simply the same precautions that are taken from all of us when we go to the supermarket, the bank, wherever we go. No one on this panel is going to a hairdresser, but to the hairdresser, it doesn't matter where you're going, precautions have to be taken. And these include the wearing of a mask, the wearing of a face shield as appropriate, maintain the physical distance, and hand sanitizing. I want to also interject here by saying that all of us, whether you're a healthcare professional or you're not a healthcare professional, if you're living in the middle of this pandemic, you have to bear one thing in mind, and that is consider yourself positive until proven otherwise, and take every step to ensure that you are protecting yourself and others around you. It means, again, you wear your mask, you wash your hands, and you wear bioprotection. So I have heard some of the comments online about whether the students have been tested on day 1 or day 2 or day 3. It really is not that relevant because the barrier protection methods are in place. And also there's the fact that if you are test negative on day 1, it doesn't mean that you're not positive on day 2 or day 3, but it doesn't matter because every day the same precautions are taken to protect both the interviewers and the people being interviewed. This information is confidential, but it does not have to be taken within your household. You can feel free to stand outside in your space and give the interviewers who have the identification clearly marked information. Or you may politely decide to not do so. That the choice is up to you. I'm going to end, Ambassador, by strongly suggesting and trying to encourage Barbadians to, just like the university, to exert your civic responsibility. What does it mean to be a Bajan and to be in this space in a pandemic that we've never faced before? It means that we'll be asked to do things that we've never been asked to do before, like lockdowns, for instance. It means that people will be coming around and asking us personal information that we've never been asked before in this setting. It also means that we may be in a situation where we feel uncomfortable because someone's in front of us wearing a mask. You're not quite sure of who is positive, who is negative. If you are positive, you are negative. But there's only one enemy in this war, and that's a virus. And I'm going to close there. Thank you.
Dr. Connell, before you move on, can you indicate, please, do you have any advice or guidance for people who suffer with chronic non-communicable diseases? You are an internist, and therefore treatment of NCDs is part of your practice and specialization. What cautions or advice would you give to such persons at this time?
Thank you, Ambassador. I'm very happy for the opportunity to introduce NCDs into a pandemic conversation. So if you have a non-communicable disease such as high blood pressure, diabetes, if you're overweight or obese, or if you are on medication that somehow weakens your immune system, here are some steps that you can do to make yourself safer. 1, monitor that chronic disease. If it's blood pressure, take your blood pressure daily. If it's your blood sugar, check your blood sugar. If you've forgotten the last time that you've made a doctor's visit, see your doctor and make sure the plan that you're on is appropriate and that your control is also appropriate. Of course, physical activity is encouraged. This is now curtailed by the curfew and the restrictions, but try to get some physical activity in. Remember, if you have a non-communicable disease like high blood pressure or diabetes, and you are not controlled, then your outcome is also going to be worse. So if you were to contract COVID-19. So therefore, it is vitally important that you take your prescribed medication, that you get in your exercise, that you consider wellness as in its totality, and that you make sure that you are aligned with your doctor's or healthcare provider's plan for managing that disease. And that's a very important question, because what this pandemic has certainly exposed, has nakedly exposed, is that we are at risk because of our NCD burden in this region to any infection, but especially to COVID-19.
Thank you so much, Dr. Connell. Members of the media, we have this evening Ian Bourne of Bajan Reporter, Stetson Babb of Starcom, Randy Bennett of Barbados Today, Barry Aline of Nation News, Emmanuel Joseph of Barbados Today, Sharika Griffith of CBC, Tanya Lightbourne of The Advocate, and Trevor Thorpe. Welcome, ladies and gentlemen of the media. Dr. Connell will take your questions at this time because, as indicated, he has an assignment this evening, a presentation with the CDC.
Yes, good evening, Ambassador. Good evening, Dr. Connell. My question concerns the Give Back students. Can they be employed with the Seek and Save exercise, and can that service be counted for their accreditation?
Okay, so this is actually a response that should really come from the government representative, but it is my understanding that those university students who are part of this program will have as much as 1/3 of their Give Back credits from being part of the program. And of course, this is an attraction to students as well, not aside from the fact that they want to contribute to this effort, being part of an Indigenous university, but they also want to be able to get some time out of their give back. And this is a perfect opportunity because it's an important give back.
Dr. Connell, Barry Allen here from the Nation. Can you give us an indication when these personnel from Operation Seek and Save, they go into a community? How do they actually select which house to knock on its doors?
Right. So Dr. Greenwich is probably better positioned to answer that, but the places are selected based on various profiling and mapping that has been done. I'll let the professionals speak to that. Once that decision has been made, the usual things will occur. The interviewers will identify themselves. I think they're all wearing well-branded University of the West Indies t-shirts. So they're going to identify themselves. They're going to approach one person from the household. Everyone doesn't have to come outside to give the information. So now is a good opportunity in your household to sit and to decide what are some of the health issues. Is anyone at home feeling ill, in terms of what information you want that spokesperson to give to the interviewer. Of course, as I said, they're going to be wearing PPE, face mask, medical grade mask, as well as a face shield, and the interview will be conducted outdoors. So the 3 tenets of infectious disease mitigation will be in place. But I will let Dion speak specifically to how the households have been chosen.
Thank you, Dr. Connell. There seem to be no more questions for you at this time. So thank you for joining us this evening. We look forward to having you again very soon. We've had that conversation about when you will join us again. Very, very useful information, particularly the advice to persons suffering with NCDs. And we know that about a quarter of our population does have one or more NCDs. So the risk factors are extremely high. We will excuse you, thank you and excuse you so that you can get to the CDC meeting, and good luck with your presentation. We are sure that it will be excellent.
Thank you very much. And I want to close by wishing all Barbadians a very safe lockdown period. Take the lockdown as not only an opportunity as an additional government restriction, but as an opportunity to just reflect on what is the purpose of what we're doing. It's not an inconvenience. There's a clear purpose to fight an unknown enemy, an invisible enemy, and that's COVID-19. Thank you, and it has been a pleasure being part of the panel.
Thank you. Attorney General, good evening to you. This is the second day of our national pause. Can you tell us, please, how the response has been so far? What has been the level of cooperation? What have been the major difficulties complained of? And is there, in fact, any issue that you think you need to elaborate on because there doesn't seem to be clarity at the national level? We look forward to hearing you this evening, Attorney General.
Good evening, Liz, members of the panel, fellow Barbadians. I remember well March of last year when we were going into our first ever lockdown and curfew period. That time, Barbadians were filled with trepidation. There was quite a bit of uncertainty, of course. And I think that our experience this time has been very different. When we were preparing for our last lockdown, we had huge lines at supermarkets. There was uncertainty as to the availability of certain things. We, on that occasion, and as now, have had a lot of questions about what is allowed to open, what is not allowed to be opened, and even why this is why a particular place is not allowed to be open. Everybody asks the same questions. Hardware stores, why aren't hardware stores open? What if I have a plumbing problem? What if my solar water heater starts to leak? I think that the beginning of the answer to all these questions is always to look at our overriding objective. And our overriding objective in this lockdown, as with last time, is that we reduce the amount of human-to-human interaction, the amount of human-to-human contact, so as to reduce significantly the risk of the spread of COVID. When we were last in lockdown, the COVID numbers were 1 today, 2 tomorrow, numbers that even then we found extremely disconcerting. But Barbadians then handled the measures well. And from all that I can see, all that I've been able to observe in the lead up to this period, and certainly as we have commenced this period, I think that Barbadians are handling it well. I don't think that a curfew arrangement, that a lockdown is something that we should ever want to become comfortable with. It is an uneasy feeling not being able to leave your home. But obviously, as I said, the overriding objective is to reduce human-to-human contact. So far, I've not received reports of any challenges from the Royal Barbados Police Force, and I therefore have every reason to believe that Barbadians are behaving in an orderly fashion. We have been issuing emergency passes, not in every instance, because obviously a request for emergency passes has to be justified. A lot of people simply assume that by going to www.gov.bb and entering the information in the fields, they assume that the pass is going to show up, and that's very far from the case. In fact, what has been happening is that there are various filters, and of course, at the end of the day, the burden is on the Attorney General to make the final decision. And frequently, I'm having to engage with people who've requested passes as recently as 3 or 4 minutes ago to ask them to justify why you're asking for a pass. But I think that we've made some changes to the system, and I'm satisfied with how that is working. Let me explain that passes related to agriculture, even though every application goes to the same www.gov.bb, when there, if your request is as a farmer, then your request for a pass will be directed to the Minister of Agriculture. If your request is as a benevolent organization, then it will get diverted to Colin Jordan, who's responsible for the third sector. And the many caregivers who are requesting passes, they get diverted to the attention of Minister Cynthia Ford. I don't have a current figure of the number of passes that we've issued, but I can say that there is certainly a lot of activity, but there are no challenges in that regard. In a situation where you've requested a pass and it has not yet been, that is not immediately issued to you, a query is certainly welcome, and we try to chase them, but often it's because data has not been entered properly or information is missing from your request. There are a couple of things, though, that everybody keeps asking about. I had numerous queries in respect of gardeners. I'm quite sure that on the last occasion when I addressed in this forum, we made it quite clear that residential maids, residential domestic help, gardeners and things of that sort are simply not allowed to go to work. One individual called me today to say that he wants to know if he can work on his own premises. To be specific, he wanted to do a particular home repair project. And remember, we're keeping you off of the road, but there's absolutely no reason why our directive should even begin to contemplate telling you that you can't go climb up a ladder and clear your drain pipes or fix a piece of plumbing or paint your own home. Those are matters that are personal. You're not outside of your bubble when you do that. So if you choose to use this lockdown period to do work at your own home, there's no issue there. We've also had queries about pools, and let me make it clear, the use of communal pools in Barbados is strictly prohibited. This is a clear mandate from the Ministry of Health, and the health officials, you may not agree with them, but in their wisdom and having all of the experiences that they have, they've taken the decision that we need to prevent communal pools from opening. Mini marts, you would know that we have a list of permitted mini marts. I can say to you that even though the list was published last Sunday, the occasion has arisen based on further consultation and strong representation that there are a number of rural areas that are not easily satisfied by shopping facilities nearby. And we've therefore added an additional 4 mini marts to complement those that already existed. Those have been brought in by way of exemption, but this weekend we will now publish an updated list. Let me make it clear. Where exemptions have been granted, if any of those entities run afoul of the established protocols, we will not hesitate to revoke the exemption. Plain and simple. And that doesn't just apply to mini marts, that applies to companies that we allow to do business of any kind. If you breach the protocols, rest assured that we are going to revoke any exemption that you might have. We've had some complaints. Some members of the public have contacted us to say that they're concerned about bread vans. You would know that we've allowed bread depots to open. I guess Barbados is a country that's big on eating bread. And, you know, we've tried to make sure that these things are accessible. But what appears to be coming out is that bread vans are going into communities and encouraging people to congregate. So we're being informed, and we're waiting for corroboration that some bread vans are parked alongside the road and attracting large numbers of individuals. And this presents a problem for us. So things of that sort we're going to be monitoring very carefully. Bread depots are specifically allowed to open in rural areas. We have not made a ruling on vehicles, but if it comes to that, we will have to come back and stipulate that they are not allowed to be on the road. Tire repair shops and so on, we've said that those entities are allowed to be on the road, and some of them have been requesting passes, and I think that arrangement is working well. Let me remind you that the directive sets out all of those businesses that are allowed to operate. It doesn't say which businesses are not allowed to operate. It says those businesses that are allowed to operate. But some people are taking the view that if it isn't stated here that so-and-so can't open, that as far as they're concerned, they can. That is not the way these directives are to be read. It would have been virtually impossible to stipulate all of the entities in Barbados that are to be closed. And no matter what good reason you think you may have for opening, if you're not permitted to open in the directive, then please keep your doors closed. Please keep your doors closed. I don't know that there's anything else that I can add at this point, but I'm happy to be here to clarify any issues that arise. I'm fielding emails on a constant basis, and I'm happy to respond to all of your queries as is convenient. But let me say, Liz, finally, that a lot of the things that are being asked this year were asked last time as well. And there's no difficulty with asking if you don't know. But we've covered this ground before. We did it safely. And I think we emerged from that experience a wiser, better society. And I'm sure that this experience, this pause, will see Barbadians responding in exactly the same way. I continue to look forward to your cooperation. If you're in any doubt, just don't do it. Thank you for now, Liz.
Thank you so much, AG. Ladies and gentlemen, it is my honor to say that the Prime Minister of Barbados will join us now via Zoom. Prime Minister Motley? Prime Minister, is your mic muted? The Prime Minister will precede Dr. Greenidge, whose topic remains the same. Thank you very much, AG, for that expansion on the range of issues which you covered, which indeed are being asked by members of the public. We got a number of queries called in, WhatsApped, and sent to us by various persons. We await the Prime Minister of Barbados. We are hoping that any technical challenges currently being experienced can be rapidly resolved so that the Prime Minister can address us.
Can I ask the AG a question? Can you hear me now?
Yes, of course. Please go ahead in the intervening period. Yes.
Stetson Babstar. Thanks for letting me back in. My previous device was not working well. You couldn't hear me. 3 questions for Dr. Connell. AG, though, I want to ask you this question. And I had the opportunity recently to review the news scripts, and especially for the last part of the year, and the very early part of this year, and there were repeated warnings about and appeals for exactly the kind of stern measures now being instituted. And not just from your political opponents who you might perceive have a political axe to grind, but from respected medical practitioners such as Dr. Lord. And in fact, BAM itself, in fact, Dr. Lord, in his words, felt the government had dropped the ball in managing this pandemic. Certainly, in the latter stages, how do you respond to that criticism that, there were warnings of what people felt was a situation and what needed to be done? How do you respond to those criticisms?
I don't respond to those criticisms. The fact is that we are where we are today. We've had Minister Bostic, who very eloquently received and, in my view, dealt with those criticisms. We've had the Prime Minister who has addressed those issues. We've had the Chief Medical Officer who has addressed those issues. So for my part, I don't think there's any point in trying to re-ventilate matters that have already been well enough ventilated in Barbados, all in December, all through January. We're now in February. We've taken the decision to shut down. To get into an exercise in whether we should have taken the decision to shut down on the 15th of January, or on the 1st of January, or on the 15th of December, in my view, does not advance our position. It might be wonderful for historical analysis, but I beg your pardon if I choose to focus on where we are now and the measures that we are implementing and that we have implemented to try to ensure that we get out of this situation.
So with hindsight, you could not have done, what might you have done differently with hindsight?
On the 3rd of February, we've implemented measures that are intended to see us safely through. Again, I prefer to focus on what we have in front of us rather than focusing on what we have behind us.
Mr. AG, good afternoon, sir.
The PM is back now, though. So, Ian, the PM is back now. So, as a matter of courtesy,
no problem.
PM?
Hear us? We still seem to be having some level of technical challenge.
Well, Liz, I don't mind if time allows, we could perhaps.
I just want to keep it
to ask his question, so we can keep it going until the PM is ready.
Yes.
It's in reference to court-ordered visits for children to their father or their father's family. Would these still be kept during the national polls?
If the PM will allow me to answer. Since she's back. Yes, well, I think she's given me the opportunity to finish, to complete this. Let me say that there is a hierarchy of laws in our jurisprudence. Court orders are matters of the gravest consequence, so that if a person does not comply with the court order, he or she can be cited for contempt, and punishment for contempt can include imprisonment. This is not a contest between our directives and the court order. If a court orders that John Brown is to see his or her child, obviously his child. If a court orders that a parent is to see his or her child at given times, then that court order must be complied with. To say that there's a COVID directive which says that you're not allowed to leave your home is really to engage in an exercise in sophistry. parents they're relied on to be responsible. And quite frankly, if a person chooses to rely on directive number 3 as a reason to refuse to follow a directive, then I would be extremely concerned, because it would mean that they're not taking an order of the High Court seriously. Take the High Court judge's order seriously. The court has mechanisms where you can apply for variation order if for some reason you are not able to comply. So if a father has COVID in his residence, then it would be absurd of a mother to say, the court says you have to take him this weekend, so I'm bringing him. Okay? I mean, that's nonsensical. So yes, we have the law, but still part of being a parent is still being responsible and acting sensibly. So to be frank, I think that we're making a lot of what, in my respectful view, is not a major issue. Please comply with court orders, but equally comply with court orders in a way that makes sense.
Thank you very much, Attorney General. Perhaps during question time we can come back to that matter, because there have been several questions raised as to whether or not a Zoom visit would satisfy the court order. There have been concerns about children going into other homes where, you know, the risk, the level of exposure is increased because of the number of people within the household and so on. So perhaps this is something that we can drill down on a little more. Prime Minister Motley, I hope we can see and hear you now. Good evening and welcome to this COVID update press conference. Prime Minister, thank you so much for joining us. Ladies and gentlemen, the Honourable Mayor Motley, Prime Minister of Barbados. Prime Minister, are you muted?
I was muted. I'm not anymore.
Okay.
It's difficult to do that. I want to first of all thank all of you for allowing me to join this press briefing by Zoom. There are 2 developments that I would like to share with the country, and I've promised you that in all that we do, that we are going to be direct with you and to come to these matters straight to you. I've literally just come out of a briefing and will leave you to go back into it, but I did not want to have the opportunity of this press briefing pass without us being able to resolve this and to speak to you. The Minister of Health and the CMO would have advised me that we do have an issue with 3 persons at the geriatric hospital, 2 of them from the kitchen staff and 1 from the nursing fraternity. And therefore, they are literally now aggressively doing the contact tracing and will do and take the necessary action to be able to put the staff rotation to protect all of the residents at the geriatric hospital who, by the way, they were all tested and all of them came back negative. So between the staff and the patients, as you know, we had an issue last week that Minister Bostic would have raised. We took preemptive action there. But in the testing that was done of the overall staff and the overall patients, we have 3 persons that have come back. We are in the process of looking to see how we can facilitate those staff members in terms of accessing more hotel accommodation for quarantine facilities for them, as is necessary. And at the same time, we are asking the staff there to meet with the staff to be able, in addition to having had the contact tracing completed, for them to be able to literally advise what is the best course of action. I do not want these things coming out without coming from official sources, because there's just too much fake news going on in this country and too much fake allegations. I believe Ambassador Thompson, you sent me a text just now as to whether the lockdown is part of some conditionality for some loan. That is absolute foolishness. And I want to dismiss it out of hand for anybody who can even believe that we would be locking down a country for this reason. So let me put that out of the way. There are 2 other matters that I'd like to address, please, before I leave. And those 2 matters relate to 1. It is with regret that I have to say to the country that Her Excellency has gone into self-quarantine. there was a member of the household staff at Government House, one of the drivers or orderlies, who would have tested positive, and the public health officials went in. They did the extensive contact tracing, and they have the good news is that on the first test, she is fine. She is negative, which came back a few hours ago, but we've had to move everyone out of Government House to allow for the in-depth sanitizing that has to take place. Regrettably, because of the level of exposure of the person and the viral load of the person, Her Excellency will have to remain in quarantine and her family until the second test is done. And I'm sure that all Barbadians would want to join me in ensuring that we pray and make sure that there's no further exposure there. At the same time, it is also my duty to report to you that although his case is not, as he did not require a test, but His Lordship, the Chief Justice, is also in self-quarantine at this stage, largely as a result of someone who is close to people, someone who works with him, displaying symptoms and awaiting the results of the test to determine what is the best course of action. Similarly, the public health officials have been in contact with Sir Patterson, and they have all agreed that at this stage, self-quarantining is all that is required for him at this stage. I am sure that all Barbadians will agree with me that this matter is a serious matter. I have said it over and over. It is not plain, and I am asking you, I heard the Attorney General just now, for example, referring to things like the bread vans acting as if they're a depot. I know it is rough. Believe you me, I know it is rough, but we have to do it. We just don't have a choice otherwise. And we can beat this thing. We can win it. I know Dr. Greenidge, I suspect, is one of the ones here to talk to you, to explain to you that what we're trying to do in terms of Operation Seek and Save, we expect it to get worse before it gets better. And that's why we're doing Operation Seek and Save, so that we can go into houses and we can do the kinds of things that will make the difference in terms of people, us being able to find the persons who have symptoms and to save them. And as I said, we are in advanced stages with a number of other arrangements that we're making, but we will come back to you in the near future. I have every confidence that I'll speak to you again within the next few days, and that we will continue to do what has to be done to keep as many Barbadians safe as possible. I am heartened by the tens of thousands who are taking it seriously, and that is why it means all the more that we speak to those who have not yet quite gotten the message and who believe that COVID is something that you can play with, or that's something that you can see, because you really can't see it. And that is what is hurting us. And as I said over and over, if you accept and pretend that you have COVID, so you got to protect the people around you, and then everybody around you equally has COVID so that you can protect yourself. That is what is needed at this stage. We are deep into a lot of other preparations. And the good thing is that I've also made some decisions with Cabinet today. And you know, in a society like this, you have to be prepared to listen. We've made a decision that the care packages will be distributed by the Barbados Defence Force. Our interpretation initially in terms of having MPs is because of their level of knowledge on the ground, but I'm not prepared for this issue to become in any way politicized. That is why we would have reached out to both Bishop Atherley, the leader of the opposition, as well as Mr. Pisa, the leader of the Democratic Labour Party, and we would have indicated that in this matter, we believe that all deserving Barbadians should benefit. And let me go and explain what has motivated how we are addressing this. I don't believe that anybody coming to certain households that are clearly upper middle income or middle income and have cash flow, that the conscience of those persons will cause them not to want to accept it. But if we send the BDF, just as we're doing with Operation Seek and Save, house by house by house by house, and clearly persons who have more than 6 or 7 people in a house will have to get more than somebody who is one person in a house. We've also created a number, as I said, I think it is 535 Care, But Ambassador Thompson, you can give it to them. For those who feel that they may have been left out for whatever reason. But the Welfare Department, the National Assistance Board, the Household Mitigation Unit, in addition then to the PDF going house to house to house to house, when we start to distribute it next week, should be satisfying it. If we accept that there are roughly 100,000 households in the country and that we have a poverty line below the poverty line is 25%, then we are at a position where that would be 25,000. But we've overshot that. And we've more than doubled it to 60,000 because we don't want Barbadians lacking for anything as we go through this difficult moment in time. This is not an attitude of a government who wants to do anything other than to care and to take care of the people who may be affected by the difficult decisions that we've had to make. And in all things, we have to preserve the integrity of the state, and we have to preserve the integrity of the lives of the people of this nation. And that is what we're focused on doing. As I said, I'm sure that as we do the pause, the prayer, the reflection on Sunday at midday, and indeed every day until then, that we will hold Her Excellency Dame Sandra up in our prayers and her family, and we will equally do so with Sir Patterson, although in his situation, it's more precautionary than a real risk. And we hope that in her case, it will also be precautionary rather than a real risk. Family, that's what we are. I'm not going to come and tell you things that are not relevant. When you hear me come, it is because I do not want you to hear things on the road. In the days of social media, it is too dangerous to have persons creating news when none exists or telling things that are not factual. So I made you a promise. I don't make promises. I don't like the word promise as a politician, but I've made this country a promise that anything that comes to me that is not sensitive to national security will be shared with you, because guess what? We are one family and we are all in this together. This is simply day 2. We've got 2 weeks still ahead of us, more or less, but I know we can do it. I'm impressed by the numbers of persons who have generally remained off the road. And I just want us to encourage each other that, as I said, in the same way that you may have to go into the hospital for, what do you call it? Operation, that you have to prepare and do it. This is our turn to just rest, relax, renew, and come again. And I know we can do it as a nation, but we have to do it together. And today's news is news that I would rather not have brought to you, but I've learned that it is not what I want, or it is not what I ideally would like, but it is what it is, and we shall go through this together, and always, always speaking frankly and fairly with each other. Thank you, and God bless. Liz, I want to thank you. I have to go back into a meeting with the doctors and with the Ministry of Health, and I apologize. In fact, I asked Minister Bostic to stay in that meeting so I would come and deal with the message on the geriatric hospital, as I was already coming to deal with the messages and information with respect to Her Excellency and Sir Patterson. Thank you very much.
Thank you, Prime Minister. I did ask to convey my apologies for my absence. Thank you for bringing this information directly to the public, sobering though it is. Good evening, ma'am. We resume our press conference, asking the public, as the Prime Minister did, to pray for Dame Sandra, Her Excellency Governor General of Barbados, and His Lordship Sir Patterson, Chief Justice of Barbados, who in various ways have now been affected by COVID-19. Indeed, all Barbadians are at risk. We know that particularly at risk are persons who suffer from chronic non-communicable diseases and the elderly. Not only must we hold each other up in prayer, but we have to find ways of supporting each other through this very difficult time. Any Barbadian, any one of us, can be struck down with this disease. We all have to follow the rules. We know what keeps us safe. Wear our masks, wear them correctly, ensure that they cover our noses, mouths, and chins. Wash our hands frequently with soap and water. Where soap and water is not available, use sanitizer when it is. Stay 6 feet away from other persons, even within your own household, particularly where there are persons suffering from chronic non-communicable diseases or where there are elderly relatives. Exercise extreme care and caution. Wear your masks around them. Don't go out. Don't go out in public without a mask. You will have to go to the supermarket or maybe to the drugstore or to buy bread or to collect some essential item. Observe the protocols when you are out in public, and when you return, bear in mind that every unprotected exposure puts your family at risk. And even though you may contract the virus and may escape serious illness, you can still infect other people with it, and they may not be as lucky as you have been. If you have symptoms like flu or cold, runny nose, dry cough, pain, fatigue, bad feels, as we would say in Barbados, there are a range of symptoms that mirror dengue, that mirror the flu. Contact a medical professional immediately. Do not wait. The longer you wait, the more difficult it becomes for the medical intervention which will save your life. Barbados, this is a major challenge. We are in a battle to save citizens, to save lives. Let us all play our part in ensuring that we beat back COVID. The doctors tell us that we can do it. It just requires discipline. It requires a level of discipline that is not beyond us as a people. Let us exercise that discipline for the sake of family, of community, and of country. Today was the first full day of the Seek and Save community intervention that has been rolled out by the Ministry of Health. With us is Dr. Dion Goodridge, who will speak to us about what happened on the ground and in the field today. Were people well received? How many households were covered? He will give us major details of the developments today, but most important, there are issues of safety, security, and well-being that have been raised by members of the public. These people should come at my house. I should talk to them. How close should I get with them? And so on. These are questions which are very relevant and which are important in determining the level of cooperation that these interviewers will give. There are some 431 people involved in this exercise. It is a huge initiative. The University of the West Indies is a significant stakeholder. Dr. Greenidge, thank you so much for giving us your time. We know that you are joining us from Command Center. Please tell us what happened on the ground today, the first day of Operation Seek and Save.
All right. Good evening, Ambassador Thompson. Thank you for having me. Good evening, Barbados. Operation Seek and Save. Currently, we have 360 students in the field, and they're in the field and they're being supervised by BDF personnel. So far, we have covered 3,236 households across Barbados, and that is within all constituencies across Barbados. So there are 30 constituencies within 11 parishes. In terms of preparations for this exercise, the students who are in the field would have, over the past 2 days, had gone through a number of activities to prepare them in terms of training for the field. And this training involved ethics, how to treat data confidentially, how to operate safely in the field from a health perspective. You know, no students were and have been observing physical distance in the field. They are not going into anyone's households. They're staying 6 feet away as they speak to residents, and they're conducting themselves in a friendly and approachable manner. So far, there have been no incidents from the field. In fact, the response in the field has been very good at this point in time. You will see from the numbers, 3,236 households so far responding to the students who are in the field. And as I said before, they're being supervised by the Barbados Defense Force personnel while in the field. And from a data perspective here at the command center, in terms of security, we know there have been a lot of questions as it relates to security. The data comes in real time or almost real time, and that comes through a secure server. Only persons who have access credentials can access that server. And we here at university believe in data protection, and we observe the protection on the campus, and therefore no one, I repeat again, no one who don't have access to the server in terms of credentials have access to that data. Okay, and as you will know, those who have completed the instrument in the field, those who have responded can testify. We're not asking persons to tell us their name or anything of that sort. We are collecting aggregated information. You know, so for example, if we go into the neighborhood and we're asking for information related to environment, and if there's grass is tall, for example, if there are containers in the area, you know, so as we can, and that will assist, for example, in dealing with the situation as it relates to dengue, for example. We are collecting, we are not there to be intrusive. And, you know, you have a right to say that you don't want to participate, and the students will thank you for your time, and they will move on to the next household. The idea is to cover every household and available residents within the 30 constituencies across Barbados within the next 11 to 12 days. So we are well on our way. This has been our first day in the field collecting data. We spent most of the time training and preparing the system, which has been prepared by which was developed and designed, I should say, by our graduate students, our MSc graduate students, in association, and that is our business analytics graduate students who are working around the clock in association with our with our information technology center unit here on the campus. So we are well on the way. We are very much ensuring that there's data protection, that we're protecting any kind of information we collect from the field. I would say, in fact, when students on their phones collect that information, it comes to the server. They can't go back and look at that information. It comes to the server. So we have taken all precautions to ensure that data is protected.
Thank you, Dr. Greenwich. Just a couple things, please. You said when students put the information into their phones, I believe that these are not their personal cell phones. These are specific cell phones. Can you tell us about that? In addition, persons were concerned about their names and personal data being recorded. Can you tell us what the process is so that the public is aware as to the level of secrecy and confidentiality which is built into the survey?
Right. So very good questions. So in terms of the mobile device that we are using, these are not students' personal devices. Okay, they are not students' personal devices. These are devices that we have given to students. In fact, they cannot make calls from these devices. All right. So I say we have taken every precaution to ensure security. As I would have said earlier, we are not taking persons' names. In fact, we're not even taking information from everyone in the household. We are going to the household, and we're taking information from that household, from a representative of that household who's willing to provide us the information in relation to that household, who will be able to help us produce the kind of information that can help Barbados as a country.
Target both COVID-19 and dengue risk factors.
Yes, that is the idea of the survey. We are looking at both COVID and dengue risk factors, and that is why I said earlier that we're not really interested in person's personal individual names, but we're interested in information that will help us to identify the risk factors, those persons at risk, those areas at risk, and to be able to make what I would say effective intervention and decisions.
Mr. Greenidge, isn't it correct that in fact no names are taken?
Again, we are not taking names from persons when we're in the field.
Just to inform the public that some 360 cell phones were provided for this exercise by Digicel. Members of the media, Dr. Greenidge is available to take your questions.
And I'm still here.
Manuel Joseph here from Barbados today. I believe you're hearing me.
Not very well, Mr. Joseph. The Attorney
Okay.
General is also available for questions.
Dr. Nitch, are you hearing me now?
That's slightly
Yes,
better.
please.
Thank you.
Okay, so I want to take you to the aspect of the voluntary nature initially of the data. From a strictly public health point of view, if for some reason it is believed that there are people in the household who show signs of the COVID-19 or who may have been infected and they refuse to give information, what is the best course of action would you think should be taken?
Okay, so firstly, this is what I will say. As I would have said earlier, this is voluntary. Persons have a right not to give us information. We are not there to be intrusive. And if persons don't give us information, if persons say, I do not want to respond to a particular question, we move on to the next question. If they say don't want to respond to the questionnaire, we move on to the next household.
I'm looking in the context of if you have reason to believe there's a case there or there's a suspected case in the household.
Believe that there is a suspect case if the person does not want to give information to the questionnaire.
Okay, I know earlier the Prime Minister had addressed this issue where she said that the Chief Medical Officer has power to, take action if there's reason to believe that you need an intervention. A case like that might occur. So you still move on?
Again, persons have the right not to respond to the questionnaire, and they have the right not to respond to a particular question. Our students in the field will move on if persons do not want to respond.
So what the health authority should do then?
I don't know if someone from health authorities here to answer that question.
Okay, can I ask a question about masks? In the fact that there is an assertion that masks with filters are not considered as effective as either cloth or N95. In fact, the European Union is stating that N95 is better than a cloth mask, but many Barbadians are resorting to disposable masks because, again, it comes back to a matter of cost. I don't know if Dr. Greenidge can answer that question or if that has to be left for another venue.
Madam Moderator,
Yes.
I didn't think Dr. Greenidge was a medical doctor. I may be wrong. But obviously, to be frank, I think the simple question is that there's no one on this call who has the training to be able to deal with that. I certainly, while I'm wearing a mask and been reading out masks and dealing with them since last year, I wouldn't consider myself to know even enough to begin the discussion. So perhaps you could leave that for another occasion.
Madam Moderator, Ambassador Thompson, maybe you can answer this question. Have public health personnel yet reported to you on this second day of Operation Seek and Save if or how many rapid antigen tests may have been conducted on the first 2 days? We know it's just the first 2 days, but can you tell us about any level of testing in those 2 days?
I don't have that information at this time, Mr. Aline. I apologize. The health officials, apart from working with Seek and Save today, have been in meetings all evening. In fact, I wasn't able to attend one of the meetings myself because of the press conference, but we can have that information available for you at the next press conference, because this is a matter on which we are going to have to keep updating the public, letting members of the public and members of the media know how this Seek and Save, Operation Seek and Save is going, what the level of response has been, what is emerging, what are the results that are emerging, because I imagine that persons will want to know the extent to which we are identifying individuals who have either symptoms or no symptoms, who are symptomatic, that is, exhibiting symptoms of the disease, or asymptomatic, infected with the disease, but not exhibiting or feeling any symptoms at all. And I explain that because members of the public have heard on the calling programs persons indicating that they're not clear what symptomatic and asymptomatic mean. Mr. Aline, in the future, we'll have that for the next press conference, but this has really been the first full day, and because of the meetings that everybody was in today, it was difficult to get it, but I will have it for Saturday evening.
So thank you. And a question for the Attorney General.
Please.
Attorney General, there's still a level of confusion in our society with the narrative regarding national pause vis-a-vis lockdown. Are you satisfied that enough people actually understand the conditions of the restricted movement within which the country has been brought for the next 14 days now, I believe? 13 days left.
Yes, Barry, I am satisfied. I mean, we've walked this road before, and Barbadians complied with the directives on the last occasion. This is only day 2. But there's no indication to me that there is any lack of compliance or any lack of understanding. I have to say that I rather suspect that some people prefer to attack the directive than to attack the virus, and I suppose that's a pastime when people have a lot of time on their hands. When we prepared this directive, we avoided legalese. We avoided the heretofores and the hereinafters and those kinds of things because we wanted to present a document that when it was completed, the average Barbadian can pick it up and read it. So for example, it says, places of religious worship shall only open for 1, 2, and 3. It shall only open for funerals. It should only open for church. It should only open for weddings. One church had choir practice today. And, I don't understand why in a case where it says you should only open for weddings, funerals, or church service, why somebody would think that there's a gray area as far as choir practice is concerned. I think that Barbadians understand what is required of them. And I think that they have been for the last 2 days and will continue to meet the expectations of the government side.
But when you juxtapose that, Attorney General, to the amount of calls you've had to deal with today, don't you think there still seems to be a level of confusion?
No, I don't think so. I mean, and I suppose a person could say that I had a lot of calls, I had a lot of emails. Cabinet met today, and I was able to give my full attention to Cabinet between the hours of 10 this morning and 4 this evening. I don't think that by referring to a lot that I mean, perhaps I shouldn't say a lot, I should just have said some. And perhaps if it seems like many, it's perhaps only because some of the same questions come again and again and again and again. But I don't think there's any confusion, and perhaps you could enlighten me as to what areas you understand there to be confusion in.
Thank you, Attorney General. I just needed some clarification. The question had been asked, Dr. Greenidge, before with regard to when your personnel, when they're going to a community, is there any science behind how a household is actually chosen that they knock on? Can you respond to that?
Hi, thanks, Barry. Now, the idea is to touch every household in every community. So that is what we're doing. We're going to every household in every community in every constituency, and we're trying to do that over the next 11 to 12 days. And it should say available residents, so persons who want to participate.
Can I ask a law enforcement question to the Attorney General, sir?
I'm here.
Okay, cool. Admittedly, it's a tiny sample size, but can you report on compliance with the nighttime curfew, any issues, policing of that period? Because even even if you listen to your own police representative on the radio traffic program, he spoke and made the point of that people of ill intent are trying to use such periods for when fewer eyes are out and about to get up to nefarious activities. You report to us on this, the compliance so far and any issues you've had.
The police, I've not received any reports since yesterday. And last night would have been the full night of the 7 o'clock curfew, the first night. But remember that we've had a curfew from the 1st of January. From then it was 9 p.m. And throughout this time, I have received no report of any issues arising out of the nighttime curfew. In fact, once more, Barbadians are, and I don't think they're being facetious, Barbadians are genuinely saying that they like this period because it is so quiet. So I don't believe that over the last 24 hours that we've had a situation where lots of people are on the road. I can't, it would be pointless for me to try to figure out why anybody on the road would be on the road other than legitimately, but I don't think there are any issues.
This question is for Dr. Greenidge. Dr. Greenidge, based on your first 2 days of Seek and Save, what are you sensing from the feedback, from the data? What are you sensing in terms of the risk as you go from house to house? What risk are you, what level of risk are you sensing with respect to dengue and the COVID?
Okay, so let me first say that this is our first data gathering day. So we have collected data for the first time today. Yes, we were in the field yesterday, but that was more allowing those students and to get a feel for the area that they were collecting data from, to get a feel of the area, to know a little bit more about that area, and so on. So as to be a little more tight in terms of collecting that data. So we collected data for the first time today, and we are at the present moment going through that data and cleaning up that data in terms of ensuring what is good, what is not so good data, and that information will be available at a later date.
Share with the public and with the media. We have the ID which the interviewers are using, and we want to share that on your screen now. It has been sent to us from the Ministry of Innovation, Science and Smart Technology. All of the students, all of the interviewers will have a specially issued ID, and that ID is coming on screen now so that you can see what that ID actually looks like. And of course, it is an official looking grouping. Members of the BDF, I believe, have been in circulation in some areas. The students, the interviewers are not coming late at night. So you shouldn't open your doors to people who are coming late at night. I'm told that by 5 o'clock our interviewers will stop their work. So please, ladies and gentlemen, take reasonable precautions, because there is, of course, some element of risk. There is the possibility that nefarious persons, wicked people, might try to use this opportunity to gain access to your premises. But we are taking every possible precaution to ensure that the public remains safe at this time while the interviews are being conducted. Are there any further questions for Dr. Greenidge? I want to share with the public the dashboard and the update on COVID cases in Barbados. So the information which is available at this time is present on the dashboard. We experienced one death yesterday from COVID-19, a 62-year-old Barbadian man who was a patient at the Harrison Point Isolation Facility. We extend deepest condolences to his family and loved ones. Yesterday as well, 30 persons were diagnosed with COVID-19 out of 485 tests conducted by the Best of Santos Public Health Laboratory. 36 people recovered from the disease, bringing the number of active cases to 352. Of the 30 new positive cases, 10 were female and 20 were male. 7 of them were sent to Harrison Point previously for assessment. And people have asked what that means exactly. It means that sometimes there is a waiting period while people are being fully assessed before they are admitted as a patient. And that is the meaning of that particular expression. Of the 23 other cases, 22 are Barbadians. The total number of persons diagnosed as positive at Her Majesty's Prison remains at 362, but that is now down to 7 active cases at Her Majesty's Prison, Dodd. So that cluster has been brought under control, and we give thanks to the prison authorities, Doctors Ford, Ward, and Arthur, who did tremendous work in bringing that particular cluster under control, even though the conditions of the prison made it conducive for rapid spread and for it to become endemic in the prison. To date, Barbados has recorded 1,641 confirmed cases. Of that number, 679 people have been women. 962 were men. 1,274 persons have recovered. And as at yesterday, there were 15 deaths. The lab has conducted 105,323 tests. It is imperative that we try to keep our families and ourselves safe. If you need support or help, please call 536-CARE, 536-2273. I remind you that we have present Ian Bourne of the Bajan Reporter, Stetson Babb of Starcom, Randy Bennett of Barbados Today, Barry Aline of Nation News, Emmanuel Joseph of Barbados Today, Sharika Griffith of CBC, Tanya Lightbourne of The Advocate, and Trevor Thorpe. We've got a question that came through social media. I would really like some clarity between the UE group and the swabbing teams. Are these two different groups, two separate groups? Dr. Greenidge, are these two separate groups? The swabbing team and the UE group? That is the question that came via social media. Dr. Greenidge, you are muted and we definitely want to hear you.
Thank you, Ambassador Thompson. No student from the data collection team will be doing any swabbing or any testing. So I will say, yes, these are two different teams.
Attorney General, question. This is about particular breaches with regard to shops. We were informed today that there may have been a breach. Can you confirm if there's been a breach that one particular shop had to be asked to close its doors? And if you can confirm that, can you tell us why?
I can't confirm it. I've received no such report, but the fact is that the directive is clear. All shops are to be closed. And if the Royal Barbados Police Force or the COVID unit found that someone was in breach, then it stands to reason that the only consequence of that would be that you are asked to close and possibly be charged. Something of that nature does not need to be reported to me, because it is such an obvious thing that I shudder to think that somebody would be so contemptuous of a clear directive. I'm not aware of it, but if it has happened, I'm very happy that the individual was shut down, and quickly so.
Thank you.
General, we have someone online asking if you would be kind enough, please, to revisit this matter of court orders. Does a Zoom visit satisfy the requirement of a court order? Is a physical, yes.
Liz,
General.
I think I'm going to avoid getting into a debate on court order or no court order. I think I've already explained it. There's nothing for an attorney general or any government to revisit in respect of a court order. In Barbados, we have something called the doctrine of separation of powers, and the executive never has an opportunity to tell a judge what he or she should or should not do in terms of dispensing justice. Let me repeat. If a judge has ordered that a person, a parent, is to have access, it means exactly that. You have to comply with the court order, or else you will be in contempt of court. That is not a matter for a directive. That is not a matter for the executive. And I cannot imagine that anyone would consider that Zoom would even remotely begin to constitute access in terms of what the court would have had in mind when it said that a father is to have access or a mother is to have access. Zoom is not access. Zoom is a convenient method of communicating, and we use it in this context. But the notion that Zoom is access within a court order is, quite frankly, absurd.
Thank you, AG. If there are there any other questions? We are going to close in 5 minutes.
Perhaps one to Dr. Greenidge.
Sorry, I heard.
Actually, via my own. Sorry, can you hear me? Yes.
Yes, Mr. Babb.
My own social media. Thank you. One of the members of the public wondered, you said you were not taking names during your survey seek and save process. But they're wondering, what then methods do you use to itemize, categorize the data so it's useful? Do you take ID numbers? And secondly, if it is determined that there is an issue at that household, would that require the household maybe to be tested? What are the implications for the wider community? Are they then tested as well? Although some of that's why you hesitate to ask some of these questions, because some of them are better put to maybe medical and health personnel, et cetera. But can you answer those two?
Good evening again. Okay, so when we approach the residents, we will indicate the persons that we are. So what we would have done is geotagging. So we indicate the persons that we're geotagging. So we would have geotagged the resident in terms of the coordinates, etc.
What does that mean, please, Dr. Greenidge? Geotagging. You're geotagging.
So, I'll try to explain it in a very simple way, because a lot of persons have a mobile device today, and what most persons do is that sometimes you want to send someone your location and you pin your location. Well, it's similar to that. You can go to a location and you can pin that location in terms of geotagging that, and that's what we call geotagging. So we come to a location and we pin in that location.
So thank you very much, Dr. Greenidge. I am going to extend thanks. I beg your pardon?
Question for you, Ambassador, before you close.
Yes.
At a previous press briefing, Senator Walcott had indicated that they were run over from the isolation facility, but Since then, subsequently, there have been quite a few cases, and there's a high level of active cases now. Can you give us an indication as to what is the capacity of Blackman and Gollop, and if there are any patients there, or what is the capacity of the isolation facility right now? How are we dealing with capacity at this stage with all these active cases?
Thank you so much. I knew that this was a question that would be asked, and we always have the challenge of how many people to have on each press conference, but I can give you the assurance that the next time we will have perhaps Dr. Ford, who is in charge of isolation facilities and can treat to this matter at length. What I can say to you is two things. First of all, that we are not yet, even though there are increased numbers of cases, that we are not yet at capacity in the national isolation facilities. That's one, and that's the key thing. Second, you will recall that Minister Walcott indicated, and Minister Bostic, that there is in fact a new national policy that where persons are asymptomatic, where they have no active symptoms but are still infected with the virus and can therefore infect others, it is possible for some of these persons to go to isolation hotels. And a number of isolation hotels have been identified. We can talk about them on the next occasion. So we are not at capacity, one. Two, there is the possibility to step up or to put into quick operation other medical isolation facilities. And three, particularly for asymptomatic persons or persons who are not exhibiting symptoms of the virus, they can go into isolation hotels, which the government is also supporting financially. There are as well private isolation facilities that are available, but we can have a conversation on the next occasion on isolation facilities and the implications for these facilities now that there are increased numbers of cases. I would remind the public that while the numbers of COVID positive persons in Barbados is increasing, that many of these persons will be people who are not exhibiting symptoms. They are not all suffering from the more extreme forms of the virus. They are not all being severely afflicted. And that is part of the consideration that determines in what manner and in what kind of facility they would need to be managed. I think this is a good point. We've been going now for an hour and a half. There's been a lot of information this evening. I want to thank for having joined.
Mind you that you misspoke. You would have said that there were 15 fatalities. Indeed, there's 16 and 90-year-old ladies. So I think we just misspoke there.
Actually, thank you very much, Mr. Babb. I didn't misspeak. Please remember that the dashboard is for the 24-hour period preceding when it is given. So that today's dashboard is closed off at a particular time for the data. And perhaps it's good to explain this to the public. When you get the daily dashboard, and we are now, I'm pleased to say, using a much more user-friendly format. It isn't only the information isn't only up on the GIS website. We are disseminating it by WhatsApp and social media so that every Barbadian can understand and appreciate that government is not attempting to conceal information. We are being transparent, we are being forthright, we are being open, and we are putting the information in the personal device, in the telephone, in the computer, in the laptop, in the tablet of every single Barbadian who has internet access. So that a dashboard for today covers the 24-hour period immediately preceding the date of the dashboard. So today's dashboard covers yesterday. Tomorrow's dashboard will cover today. And you can appreciate why. The information is collated, you get it at the end of the day, you do the necessary analysis, and then it is made public. So that is one of the measures that have introduced, that we use a cutoff point so that you aren't having random blocks of information being given. They are for set definable periods. And therefore, yesterday, a 62-year-old man would have died, and therefore the information for today was current up to yesterday. So yesterday's dashboard would have shown the 15th death. It is accurate to say that today there was another death, so there is a 16th death, but that will not be formally recorded on the dashboard until tomorrow's dashboard is done. So long explanation. I'm sorry, Mr. Babb, I didn't hear you.
I said thank you for that. That explanation was useful for members of the public who are wondering why.
I took the time to explain because I know that the format for the dashboard is one of the changes that I've introduced, and I don't think that I've ever explained to the public why some of the changes I implemented have been implemented. But you understand now that, and frankly, we used to have information coming to the Ministry of Health at the last minute when they were about to do a press conference, and that put them in a position where they couldn't answer some of the information, and therefore I felt that it was better for us to use a discrete or a very clear cutoff point for collecting information for the dashboard and for the public, therefore, to know what period it covers. So when you get a dashboard today, it covers the day before, and I think that is now clear for everybody. And if you look at the dashboard, it actually carries, even though you get it today, it actually shows the preceding day. So that I think now is clear. So thank you very much, everyone, for attending this evening. We've gone a little longer because of all of the issues. I should like to thank Drs. Kenneth Connell of the University of the West Indies, a medical practitioner, Dr. Dion Greenidge, a PhD, an academic doctor from the University of the West Indies who has been intimately involved in the design and implementation of the Seek and Save survey and community intervention effort, and the Honorable Attorney General, the Honorable Dale Marshall, who has been explaining measures related to the lockdown. As I do on every occasion, I want to share with you some of our key takeaways. First of all, that this survey which is being implemented, and I should just like to say in closing that this evening on Starcom Network, I heard a program with Mr. Larry Mears, and people were calling in, and one lady in particular indicated that the interviewers were actually in her community, and she gave extremely high praise to the student of the University of the West Indies who came to her door for her professionalism and the manner in which the survey was conducted. She indicated that it was clear that they had been well trained, that the young lady was extremely polite and very nice, and she cooperated fully. And I think that Dr. Greenidge, no further compliment could be paid to you and the team than from that kind of unsolicited remark from a Barbadian who just happened to be calling into the program and saying, this is what happened to me today. So good luck to all of the interviewers. Stay safe. God bless you all. And to the questions, there are a number of questions that will be asked of you, but the two significant health questions of the survey revolve around dengue and COVID-19. Remember, as Dr. Connell said this evening, as Dr. Ford and Dr. Best and CMO George have been reminding us, and Dr. Walcott as well, that the symptoms, the reaction, the way you are coughing or not, the symptoms can mirror each other. And equally, there is an environmental effort ongoing in this Seek and Save because dengue is also potentially fatal. Dr. Connell indicated that those persons with chronic non-communicable diseases have to be extremely careful, that they need to monitor whether it is their diabetes or their blood pressure on a daily basis to ensure that in this time of great stress they are not out of control, that they must speak with their doctors to implement a current management plan, and that they must strictly follow it and religiously, that they should also make some attempt to exercise. The Attorney General gave us a significant amount of information, but in essence, he's telling us, stay home. For our own safety, for the safety of others, let's just comply with the directives, stay at home. That is the surest way of not infecting other people or not getting the disease ourselves. I'm receiving a message that from the Attorney General that right. So we will move on to the other, thank you, AG. We're going to move on to the other key points by Dr. Greenidge, and they are that confidentiality agreements have been signed by all the students and persons participating in this exercise, that persons doing the interviews have no access to your personal information, that names are not to be taken, that there is a geotagging or technological method of identifying households, but not people's personal information and not people's ID numbers or names. So if you are interviewed, it should be a completely confidential process, that the information is uploaded for the Ministry of Health and Wellness, and even the interviewers, once they enter the data, their access to it is finished. So that assures you of issues of confidentiality of your information. We shared with you on screen the special ID that the interviewers are using, and we indicated for reasons of safety and security that the interviews will not be conducted at night. Our interviewers will not be coming into your homes. The interviews can be done outside if you so wish, and if you feel more safe in that environment. We ask your prayers and support for Her Excellency Dame Sandra Mason, Governor General of Barbados, who is in isolation at this time. We also ask for your prayers and support for His Lordship Sir Patterson Cheltenham, Chief Justice of Barbados, who is also in isolation. COVID is affecting this country in a way that perhaps we had not anticipated. But the Seek and Save intervention at the community level is intended to bring this wave to a halt. Let us all cooperate. Let us follow what we know are the safety protocols and regimes. Wash our hands regularly or sanitize. Wear our masks correctly to cover our noses, chins, and our mouths, and stay 6 feet away from other people. Even inside our homes, develop safety protocols and follow them. And where we have elderly relatives or family members or loved ones who are afflicted with chronic non-communicable diseases, diabetes, pressure, let us exercise extreme caution. We are assured by the medical personnel that this battle can be won, that working together, Barbados can beat back COVID. Let us join together as a unified people in this battle, and let us win it. Good evening.